Welcome to Season 3 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Josh Sharfstein, Vice Dean for Public Health Practice and Community Engagement and a former Secretary of Maryland's Health Department. Our goal is to bring scientific evidence and experience to the public health news of the day through informative interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hi, I'm Lindsay Smith-Rogers, producer of Public Health on Call. Today, Stephanie Desmond talks to Misha Zilberman, an endocrinologist at Johns Hopkins Suburban Hospital. They discuss the links between diabetes and COVID-19 and the concern that more and more people are developing diabetes after they have been diagnosed with COVID-19. Let's listen. Misha Zilberman, thanks for joining me.
It's my pleasure to be here.
So today I'd like to talk to you about COVID and diabetes. I think I'd like to start with the fact that it appears that diabetes is a risk factor for COVID. And so I'm wondering if you could tell us a little bit about why.
So we don't know yet why diabetes is a risk factor, but we know that patients who already have diabetes have much worse outcomes if they have COVID-19. There was a really important study which came from my colleagues in England, which stated that more than 30% of patients who died in a hospital had diabetes, died in a hospital because of COVID-19.
So how do your patients feel when they hear that? I mean, do you have a lot of nervous patients?
Yeah, patients are not too thrilled, and some of them are nervous about it. The challenge that we've been experiencing right now is that we noticed that patients who are coming to the hospital without history of diabetes now have new diagnosis of diabetes, and we don't really understand why. Before the pandemic, my team at Suburban Hospital where I work would see probably about 15, 17, 18 diabetes consultations per day. But as the pandemic started, probably in April, our numbers increased to 25, 30 patients per day. And this number never really subsided significantly, despite the pandemic finally getting better. And even yesterday, I saw a patient who was admitted to the COVID ICU. And this particular patient was found to have high blood sugar. And I spoke with her. I said, well, we found that you have diabetes. And she said, there is no way I have diabetes. I go to doctors. Nobody ever mentioned this before. But I did say it. Well, we found you have high blood sugar. Let us investigate more. So this particular patient is now requiring insulin while she's in intensive care unit.
Wow. So you're seeing new diabetes cases in people who've been hospitalized for COVID.
Correct.
And we don't know why?
We still don't know why. We can speculate. We know that there is some sort of a bi-directional relationship between COVID-19 and diabetes. So we did say that patients with diabetes will have increased risk of COVID-19. But now we are seeing more frequently some sort of a new onset of diabetes, maybe with some associated severe metabolic complications of pre-existing diabetes. Some of the patients who have diabetes come to hospital and now develop diabetes ketoacidosis, which is a life-threatening complication usually seen in patients with type 1, but patients of type 2. Some patients who are coming, who are admitted to the hospital and have diabetes require extremely high doses of insulin. So that's all we've been seeing here.
And you speculate that COVID is causing this.
We speculate. So we have some ideas. So one is that we know that the virus, the SARS-CoV-2, the COVID-19 virus, may bind to particular type of receptors. We call them angiotensin converting enzyme 2 receptors, or ACE2. And those unique receptors are also located on the cells which are responsible for producing insulin in the human body. So we call those beta cells in the pancreas. So we speculate that since we know that COVID-19 may bind to these particular receptors, may also affect directly pancreas and thus affect the way our body, our pancreas is producing insulin.
And so I guess this would be one of those symptoms that occurs in people who, have a severe COVID. Are they also perhaps these long haulers, folks who have long-term COVID?
We don't know yet. There is another theory behind it. Remember that many of the patients live in the United States and not just in the United States, have high rates of prediabetes. So if we can step back for a moment and talk about what prediabetes is. Remember, prediabetes is a condition when the blood sugar levels are higher than normal, but not high enough to be diagnosed as type 2 diabetes. And in the United States, more than 1 in every third person has prediabetes. We believe more than 88 million Americans. And the risk factors for prediabetes are being overweight or obese, age above 45, and there's some also race and ethnicity may play a role. And interesting, those are exactly the same risk factors for worst outcomes in COVID-19. So it is possible that COVID-19 infection just pushing the body to kind of fight the stress, fight this virus and raise the blood sugars. And those patients are developing who had underlying prediabetes or previously undiagnosed prediabetes, now developing very high sugars, which are consistent with diabetes.
Do we think that this is a permanent condition following COVID, or might it resolve?
So we, again, don't know yet. We know from the previous coronavirus pandemic, so there was a pandemic 11 years ago. There was an interesting research paper published by my colleagues from China in 2009. They found that the SARS coronavirus was damaging islet cells and was causing acute diabetes. Remember, it's a different virus, but it's from the same group. And some of the patients who had this virus developed diabetes, and of those, and most patients had diabetes resolved in a couple of years, but some of them continue to have diabetes. So it is possible that this condition may become permanent.
But it sounds like a large percentage, at least during the SARS outbreak, did not have permanent diabetes, although it sounds like they had it for a few years.
That is correct. Again, this was the paper which was published a long time ago. Only look at 39 patients, so it's a fairly small study. We're going to know more in the coming months. Obviously, the number of patients infected with COVID-19 is much higher than 39. My colleagues at the King's College in London created a robust database where collaborators, researchers from different institutions around the world can log in and enter patient information into the registry. And I'm sure there will be some important research papers coming out of this registry, and we'll know more about the phenotype, means what do those patients look like who present with a new onset of diabetes, and for how long they have diabetes after resolution of their COVID-19.
But yeah, I guess it's just yet another thing we have to worry about. Should we get COVID?
It's concerning. I'm not encouraging you to worry about it. But my suggestion is for those who are already at risk for type 2 diabetes, like something that I mentioned previously, if you're overweight, if you're 45 years old, or if you have close family members with type 2 diabetes, or if you're physically inactive, and many of us were not physically active during the COVID-19 pandemic, you should definitely talk to your doctor about screening for type 2 diabetes. It's a very simple blood test, either fasting glucose or hemoglobin A1C. We also noticed that there has been an increased number of cases of type 1 diabetes after developing COVID-19. I heard from my pediatric endocrinologist colleagues at the University of Maryland and from here at the Johns Hopkins Health System that we've seen more new cases of type 1 diabetes and been asking why. And while we still don't understand why, I think that those who have a family history of type 1 diabetes or have a concern for type 1 diabetes should also ask their doctor if they should be screened for type 1 diabetes.
Well, Dr. Zilberman, thank you so much for your time. I really appreciate it.
It is my pleasure. Thank you.
Public Health on Call is produced by Josh Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by Spencer Greer, Niall Owen McCusker, C.N. Oates, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo and Neiman Outland. Social media support from Brenda Haggader, Grace Holes Fernandez, and Caroline Wong. Thank you for listening.